There are key changes going on in terms of funding and costs. Wherever you look around the world, healthcare systems are facing unprecedented pressures. The growth in costs continues and outstrips GDP growth. There is huge pressure to actually control costs in an effective way, while at the same time there's growing consumer demand, growing expectations. This is also compounded by ageing societies. People are living longer, there's a greater burden of chronic disease. There's actually a need for changing healthcare facilities. Family and funding mechanisms are changing. What we're also seeing is changes in lifestyle. Almost what you'd see sort of two divergent things happening. People focusing greatly on healthy behaviours, companies increasingly focusing on healthcare services, wellness services. And at the same time as these efforts around prevention and positive health, we also see that burden of growing chronic disease, growing illness and impact from things like diabetes, chronic heart disease. So that sort of paradox between greater health services, but also greater demand from disease. Wherever you look around the world, healthcare costs are rising above GDP. In America, the increase is about 2.5% above GDP. In Europe, slightly better news, it's about 2% above GDP. But however you look at it, this level of medical inflation is simply unsustainable, and this is a problem we need to address together. The private healthcare market is not functioning effectively for consumers. And actually there's a few features in the provider market and the role of consultants that individually or working in combination with each other prevent, restrict or distort competition in the market. The most important thing that we're trying to drive for is to get better value healthcare for our customers. And we'll do that in two ways, by providing a better experience and outcome, and also through mechanisms to keep private healthcare more affordable. What we also bear in mind though is that there is a free alternative, the NHS. And if we try and keep premiums affordable by cutting benefit, we remove our differentiation compared to the alternative. So this is something we consider quite carefully. We hear more updates of the NHS reform bill going through. It's been a pretty rocky ride. It's gone through its third reading, I think. It's gone through to the House of Lords. It's had more than 1,000 amendments. And still, with all these amendments and political process, most of the major medical organisations oppose the bill. Healthcare is political.